Hello, greetings from the day. My name is Ria Makwana, and welcome to the another episode of Future Doctor podcast with Canberry. I am joined by a very prestigious university from Lithuania, Lithuanian Health Science University, and along with me, I have Miss Justina and Miss Ruta, who are international relations officer at Lithuanian Health Science University. Along with them, we also have admission two students ambassadors, Ms. Dianka and Mr. Faizar Patel. So they will be sharing a lot of insight about the university, and I'm really glad to introduce all of them today for this wonderful podcast. Would you want to introduce yourself and maybe talk a little about the university?
So maybe I'll start since I'm just supposed to be the main speaker. As you presented me, so my name is Ruta. I am admission officer, and to say the truth, I already working in this position more than 20 years. So I know about university and about admission requirements. As well, I want to notice shortly that is a long list of questions. So I suppose that some questions could be even plus to one answer, especially introduction and so on. So just let's agree that if one question could be followed by other questions, and I'll answer in one portion. That's all. Justina.
So hello, I am Justina Vanžadienė. I'm international coordinator as well here at the Lithuanian University of Health Sciences, as well working for more than 10 years. And I'm ready to answer the questions that we have today together with my colleagues and student ambassadors.
Hi guys, my name is Dianka Leroux. I am a fourth year medical student here at LSMU, and I am from South Africa originally, but I really love university here, and I'm excited to answer your questions.
Hello, my name is Faisal Patel. I'm from Mumbai, and I am studying fourth year pharmacy at LSMU here. And I'll be happy to answer all your questions.
All right, then I think we can get started with all the questions. First of all, I would like to know more about Lithuania Health Science University, where it is located, a few details about the campus and the facilities at the campus available for the students.
Okay, so as I told, so maybe we'll accumulate some questions to one answer. So a little bit, I am looking to the side. I have an official presentation, so I'll try a little bit to use it as answering the question. So I want to tell that our university is older than 100 years because it was founded in 1921. It was a long story. It was a lot of change of names, maybe just due to geopolitical situation and so on. But finally, now we do have two academies, Veterinary Academy and Medicine Academy, and the general name is the Lithuanian University of Health Sciences. It is a specialized university of health sciences, and maybe this is like a main feature because all the study programs that are taught at our university are related to biosciences. As well, in our country, we do have another university that gives medical and dentistry programs, but this is a comprehensive university, and it seems, from my understanding, it's a great difference because we could completely give only, we are teaching only biosciences. So our university is high ranked in European and world university rankings, and we may say that for year 2024 we just were in the, how to say, first that okay, it's too low, 500, but if to imagine that our country is not big, and as well university is not too big because serving for our local people, so we are very proud of this, and it, on our understanding, it's very high ranking. University has two campuses, and there are two academies. So one campus is for veterinary academy and another for medical academy. So I don't know if I should go deeper to hospital, because it could be related to other questions. So shortly mentioning that we have the main hospital, university hospital called Kauno Klinikos, based on the name of our city. Is the biggest hospital in our three Baltic states. It means Lithuania, Estonia, and Latvia. So shortly, because we have a lot of questions, yeah?
Fantastic. I'm sure students are going to be very excited after knowing all of this about the university. So we have got a few questions about the academics and the program. Which is offered by Lithuanian Health Science University. So, if you could elaborate a little more about what is a year one curriculum looks like, what students are going to, start studying at the university, how are the exams at the university evaluated, students are evaluated, and any other information that students should be knowing starting from year one.
So I think that I may tell it, but maybe in this question, so I'm looking now to Dianka. You are an expert already, you are a fourth year student. So I may tell you theoretically, because I'm not studying, and you may say what you had done during your 4 years of studies and how it's divided. How first and third year is more theoretical, and then it goes to practical. So Dianka, it's your floor now.
Exactly. Okay. So when you're coming here first year, you're going to start with the basics so that everybody is kind of on the same level. So you'll start with subjects like histology, anatomy, some chemistry, a little bit of everything. And the way that the university is organized is that we have a module system. So you do one subject at one time, and so that you can devote all your attention to it and completely understand it. And then that follows with an exam. This exam, to kind of answer some of the other questions you guys had already, you have one opportunity to write this exam. If something goes wrong, you fail, unfortunately, you are allowed to retake this either during our retake week in autumn semester or retake week in spring semester. And then even if that goes a little bit wrong, you can retake it one more time before the start of your next year. So I think that's something that's really special about this university, and it really allows students to breathe if something goes wrong, but to still continue their studies strongly. So that's your first year. Second year and third year looks sort of similar. And then when you reach fourth year, like I am now, or third year in the new program, you'll start with a little bit more practice. So I am currently working at one of the hospitals, and for an entire month, you're completely indulged in this specialty kind of, and you work the shift the same as a nurse, and you follow a nurse along, and you get a lot of practical experience. So it's a wonderful setup here.
Wow, that's great to hear. So another question is, a lot of students wants to know what is their chances of getting into the university. So if you could also let us know how many international seats are available for medicine and dentistry program, and what is a typical acceptance rate following the entrance exams that students are going to write.
Yeah, so when I'm taking this question, so I may tell you exactly that it's officially stated by authorities of the university that for international students that the studies are going in English, so we do accept each academic year, we do accept 170 students to medicine, to general medicine, 50 students to dentistry, and some less to other programs that going. But as I understood, Ria, you are asking about medicine and dentistry, yeah? As well, we do have and pharmacy and health psychology and so on. Of course, it's less for pharmacy, 20 students, for health psychology, some 15, 20. Because just these numbers are based on this, what study programs are most popular. So, of course, general medicine was the top. So, as I'm repeating, it's 170 and 52 or to dentistry. And about the entrance test, and you say about the rate, acceptance rate, it's maybe could be complicated to answer what is the acceptance rate, but the idea is if any applicant studies very good at high school chemistry and biology, usually they are successful in an entrance test. So it depends again on curricula, what do they doing in their schools. So like in Emirates, so it's usually Indian curricula, American curricula, and maybe it could be some this maybe STEAM or something. Yeah. So all these programs they do, or for British it's advanced level. So we do require. So in advanced level they're doing A levels chemistry, biology, and getting B and B. So we even exempt them from entrance test. So just only motivational interview. For other programs as well, we are looking what are the grades they're getting in their final year and final examination. And of course, all this information is provided on our website. There is, I do hope that Justina do hear me. So you may add to the chat. There is exemptions from entrance test, and there is listed basing on curricula what grades having student could be exempted from entrance test. Of course, if somebody were not studying very good at school and they have lower grade, so as well we do allow for them to improve their knowledge and sit entrance test, because admission is based on grade of entrance test and motivational interview. As well, I want to mention that motivational interview is very important. We have a special formula to calculate it, because if a student is coming and he or she doesn't know anything about our university, about our country, if it doesn't know, if anybody doesn't know the idea and they do not have any motivation to study one or another specialty, so of course it could be that they are failing their motivational interview. And if to say just in numbers, so it could be so that we are getting about 1,000 applications, and we do admit in general about 400 students, so just in average.
So to summarize, it is not only important for students to study well at high school, but they also have to focus in high school to because that is going to help them clear the entrance exam and to have a very good motivation to get into the university. So all of it is important that they have to study really good in high school, get good grades, and then pass the entrance exam and motivation interview.
As well, it could be possible, sorry, just a little bit to add, it could be possible, but a case, I understand young people, maybe they are not, they are 16, 18, or maybe they're not studying at school, this main needed subjects. So when it's okay, they may have a gap or from high school for 1 year and to ask some teachers or some courses, some special courses, some foundation year, and they could be admitted to our university basing on entrance tests and motivational interview.
Understood. Wonderful. So I'm sure students have taken note of this because this is very important for you all to know. My next question is, I've received a lot of questions about, is it important to know Lithuanian language before they get into the university? Do they have to do any course, any studies, or just knowing English fine would be more than sufficient to get into the university?
So I'll shortly answer, and then we'll move the floor to Dianka and to Faisal. What is the need of Lithuanian language? But shortly, it's officially and it's for sure not required to know Lithuanian language as you enter the university, because everything will be in English, and then as well the same is in the city. In the public transportation, mostly people are speaking in English. So of course, it depends on a person. If somebody wants, so they may prepare themselves to say hi, thank you, and so on. And as well, during the studies, they'll have classes for Lithuanian language, because it will be needed for their future in hospital. So now, I don't know, Faisal or Dianka, what you add about the needfulness of Lithuanian language?
Sure. So when I arrived here, I basically thought there's no need of Lithuanian language, which was true, as Ruta mentioned. But for your personal stake, if you want to learn Lithuanian language, university has more courses for more than 1.5 years, which is 3 semesters. So basically, in first semester, you learn basics of Lithuanian, hi, hello. In second and third semester, you learn professional Lithuanian. If you are a medicine student, you learn according to the medical terms, like what's operation and what's headache and everything. If you are a dentist student, you learn about the more about organs, and if you're a pharmacy, you learn more about medicines. So basically, university helps you a lot for more than 3 semesters, or like less or more 3 semesters. But if you want to learn more, it's up to you. But answering your question, you don't really need Lithuanian language knowledge while arriving in Lithuania. After you have arrived here, and if you want to survive after you graduated, then of course you need to know the local language. So yeah.
Absolutely. Thank you so much for your insight. So my next question is, because our students are high school students, they are treated very nicely at home. So when they go to a university, they feel homesick. And everything is new for them, new country, new university, a complete new environment. So not just that, plus the high school curriculum is very, I would say, at a not that competent as compared to first year medical school studies. So are there any, I would say, students who are not able to clear the first year and they have to drop out from the university, or there are ways from which they are able to cope up, or there are any, counselings happening inside the university to help these kind of students who are maybe a little slow to catch up the curriculum and, to get on the track?
So maybe I'll give a floor to the students if they'll miss something, or maybe they didn't even use such a service, so then I'll add. Okay, so tell guys how it was, how it happened that you arrived, when you.
Perfect.
Maybe-
I can go for it at first. Yes, on the homesick thing, definitely. I'm also very far away from home, so that was a struggle in the beginning. But in terms of support from the university, there's one aspect of it where you are able to go for free counseling. So we have therapists at university that speak English that could either do an online consultation or they can do in person. So that's up to you. I have done it before and they really help a lot, especially if you just need someone to talk to. But I can say that because we are only a medical university and everybody is struggling. So you're not struggling by yourself. You have this kind of community, and right from the get-go, you're making friends, you're always studying together, you're living together, everything like this. You're not alone. So that's definitely not something that I would say is too worrisome. It's always hard in the beginning, but it's not the end of the world.
I'd like to add, for example, if you are defining struggling as one aspect, like as international students struggle is too much. It has food struggle, it has financial struggle, it has homesickness, it has studies, it has friends, it has many more things. So for that matter, as me and Dianka, we both are mentors for international students as well as Erasmus. So basically, just to let you know, we believe in privacy matters. So if a mentee comes to us and asks about something, about anything like studies or how to make an Isaac card or how to use public transport, we don't feel like why that person doesn't know that. Of course, he or she is a new person and she needs some kind of assistance. So we as mentors, we make sure to help them out before they go to the university, because of course the officials at the university are pretty much busy, but so they made us as a bridge between the university and the students. So we help them out with every possible thing regarding studies, because if he or she is my junior, I can let them know how this professor is or how the course is going to work. So if it's studies, if it's financial, if it's how to survive in the city, we help them out in any case. So we make sure the struggle is less. But of course, in case of if it's homesickness or you can't make friends, we do have psychologists and counselings going on in the university.
If I may just add some maybe conclusion out of this. So university is oriented to have students in the university. We don't want our students to drop off. We are not focused to admit as many students as possible and then some of them to get out of the university to one reason or another. So for that reason, we do offer like a package of help. So as our student ambassadors already mentioned, so there is psychological counseling, which is free, As well, there is mentor support, so it means that when you arrive on the first day here in Lithuania, you will have a mentor, which is an upper year student who will help you to get around the city, to get around the university, and to adjust a little bit, like step by step, to all the new environment that you will be in. As well, one more thing that we offer is tutors. So it's again senior students who will help you in the case if you don't know how to study, let's say, anatomy or histology. Then university offers a lot of sports activities. I do hope that Dianka and Faisal may agree with me. So you can get involved into many other activities besides your studies, and it will help you to overcome this cultural adjustment difficulties in that way.
I'm sure that's going to be a lot of relief to all the parents and students who will be listening this podcast, because this is their main concern. How will my daughter or my son adjust into university all alone? Oh my God, what do we do? So please don't take any tension. Do not worry. There are mentors, there are tutors, there are students who can help you out at the university to adjust.
And as well, sorry to interrupting you, I want to add that, of course, our international office is always open for students from early morning until end of workday. So, and they are coming here and asking various questions, sometimes crazy, but what to do? We are answering and we are trying to help them.
Absolutely. Thank you so much for that, because, of course, this is going to be a lot of relief to the students. My next question is about, are there any exchange programs or global partnerships to enhance students' learning experience at the university?
So I don't know either students will speak about exchange or I may shortly tell that, of course, we do have exchange Erasmus and Plus and Simple Erasmus, that there is an exchange of students between European countries, and as well we have agreements with so-called not countries included in European Union. So it's very popular, and students, they do like to go to do one or two semesters abroad outside of Lithuania, and it could be started. Practically, the best time is to start from third or second year, because as you are the first year, so just only basics. So maybe student, I don't know if Dianka or Faisal, have you been on exchange or not on Erasmus?
I haven't been until now, but this summer, July and August, I'm going to Turkey for Erasmus traineeship.
Yeah.
So yeah.
And if you, of course, there is a competition to get a place in some university outside Lithuania. But if our students are active and studying very good, so of course they are successful to go abroad and to do 1 or 2 semesters.
Yeah, so it goes like this. You have to apply for the Erasmus, and then the application takes into consideration many points: your motivation, your average score for the last 2 semesters or 3 semesters, whatsoever been. What country are you choosing? How many places that country takes into, and also just one stress if students are taking, not to, just to make them happy, that you don't have to pay anything for the foreign university. You just have to pay to your own university, and plus you get funds from Erasmus funds or European Union for every month. So it depends upon the country. According to the World Bank, how much is the popularity of that country, you get some funds to spend. So you can spend that money on accommodation, on food, or traveling, everything. So basically, university is giving you a chance to prove yourself in foreign bodies or outside Lithuanian borders and represent Lithuania as well as LSMO.
Yeah, and just to add to that, there are a few more programs where you can have a bit, this is later in your years, where there's some more practical placements. One example of this is the university has now opened applications for 16 students that are being exchanged with 16 Japanese students, and we go to work in the hospital there and they come to work in the hospital here. And I think it's a really, really wonderful opportunity, and all we have to pay is traveling costs. So this as well, obviously your average and your motivation and everything is taken into consideration, and it's also a competition, but it's a really wonderful opportunity that you wouldn't necessarily have at another university.
Wow, that sounds really good, and very. I'm sure students are going to be excited once they join university, and if they work hard, they can be part of one of these programs that you have mentioned. So again, thank you for that. Moving on to clinical trainings and facilities. So, what clinical training opportunities does university offer, and how does it ensures that the exposure to diverse medical cases offered to each and every student?
So as I already mentioned, so that the university has an university hospital, so-called Kauno Klinikos, is the biggest hospital, how to say, in our three even neighboring countries, and it serves for and it serves for, even as I may tell you, if somebody has a doctor in the family, so you may imagine that it has this clinicos has 2,000 beds, so it's imagined at the same moment that more than 2,000 people could be hospitalized. As well, there are some affiliated hospitals that are even located not only in our city. In our city, we have 5 affiliated hospitals affiliated to university, and there are as well in our resort next to Baltic Sea. It's a rehabilitation center. And students, they are all doing all their practice in these mentioned clinics. So maybe more than, guys, how are you going? Maybe it's for the younger more to how are you going to hospital and how you are getting doctor's assistance.
Yes, absolutely. So right now, as I mentioned, I'm in my clinical placement. So this is a month-long situation, and in 4th year, you're placed with a nurse. So this nurse, they speak English, the nurse that you are assigned to, not all of them. So it can be a little bit difficult, but this nurse, she guides you through the first, second day about, and then after that, you have learned so much, because they're extremely helpful, that you are given a lot of independence. So a lot of my practice, I'm in the surgical unit, surgical ward right now. A lot of my practice in applications of medications, mixing medications, everything like that, very much nurse-based work, but important things for doctors to know, to acknowledge, and to know how to do as well. And then in our later years, we have more extended practice and more opportunity to see surgeries. And with this kind of independence that you have while you're there, you are absolutely allowed to speak to doctors, speak to other nurses, learn things from different staff members. And even one of my colleagues was in a surgery today because he spoke to the doctor, and the doctor allowed him to kind of view the surgery, even assist here and there. So it depends on your ambition, and it depends on your communication level and how well you are doing in your program. So all of these things are still very important, but you have the opportunity to practice and to learn regardless.
So as I know on my practice that not all universities and not all hospitals, houses in Europe and around the world, they do allow students of the 4th, 5th year, they do not allow them to face-to-face to meet alive patients. They're mostly working on theoretical issues. So it's like some of pluses for our university and our hospitals, that they do allow students to be in direct contact with the patients.
And maybe, Faisal, you can add something about your own experience in a bit different, not patient treatment experience, but what is your experience on that?
So my experience with pharmacy is more like, as we always say, that the university name itself mentions this is a University of Health Science. So basically not just medicine and odontology, but every course students are supposed to meet patients and see them and ask them questions in a way that, of course, the patient is Lithuanian and he or she is like mid-40s or 30s. He or she won't be speaking English, but the professor or the nurse, he or she is always with you and trying to translate all the things whichever is going on, like what the patient tries to tell you and what questions you are trying to ask to that patient. In that case, as a pharmacy student, I also had some practice for 2 semesters, which is almost 12 months. and I had practiced with internal diseases patient, because as a pharmacist, if I don't know what's going on with my patient, how am I supposed to make medicines? So basically, LSMU believes in hand-on-hand practice. As Bianca already mentioned, that it's just 1 or 2 days the professor is going to help you, and then later it's you who has to take initiatives and be independent in your life. No one's going to help you to be a doctor, right? So yeah, basically I really like this stuff, that where professors try to help you, they're always behind your back. Of course, they won't let you do anything wrong, but they won't interfere in all your stuff. You have to take initiatives, and I really like this. So yeah, treating patients, talking to them, learning about anatomy and physiology, how medicines work, how my patient, should I treat my patient, etc. Okay, this is just about internal diseases, but we also have hand-on practice with pharmacy. So in pharmacy, we have a small pharmacy, a demo, wherein the professor acts as a patient and we are supposed to act as a pharmacist, and we should know how to treat our patient when the patient comes in. We have clinical practice. If the patient asks, like he or she has blood pressure and he or she needs some medicine, so I can't just give any medicine, I need to consult that patient. So basically, these kind of important roles which university teaches you play an important role for future career.
And maybe Dianka, you can add a little bit about H labs. Um,
Yes, this I can definitely say. Before we are even going to these practical placements, you're not going in blind. We have, with every subject that we do, we have a mandatory practice times in something called H labs. So these are hybrid labs, and it's where you work on, say, if you want to learn IVs, you're working on a mannequin. So you're allowed to practice as many times as you want, and there are a specific amount of times you do have to practice. And you are evaluated on this because they take a video of you while you're doing it. So you're never going unchecked, and you're allowed to practice as many times as you want. And then you also, in those H labs, you learn to work as a healthcare team, because all H labs are practiced as a 3-people team. There's always one supervisor, one assistant, and one being the actual practitioner. So this is very important for our general being a doctor ways, because you always work as a team, and you always have to learn how to navigate those dynamics. So H labs, you can do almost anything in there, depends on the module that you're busy with. So we learn IVs, we learn medication mixing. In first year, we learn first aid and how to take measurements of your patient, so body weight, height, circumference, things like that are also very important. So you never go untrained. It's very nice.
So the practical stuff basically starts in the very beginning, I guess. You are maybe not going directly to the hospital, but you face the problems in the H labs. The same goes for the dentistry students. They do practice in the beginning on the phantoms, in the phantom classes, and then later they start practicing a little bit on each other. And later having the patients from outside coming and then practicing on them with a supervisor. Yeah.
Also, just to add that I was also once a patient to a student. So basically, they upload some text on Facebook and WhatsApp that, I'm a 5th year or 4th year odontology student, and I would like to, just have a dental checkup just to prove myself that I have skills. So basically, even in such matters, the professor never leaves that student. The professor is always with that student, checking if he or she is doing in a proper way, making their mistakes in a proper way, and resolving them all their issues. So yeah, like you get all the chances to get checked and to be checked by the patient or the doctor.
Thank you, Faisal.
Very interesting. This is very useful to know in such a detail, because I'm sure a lot of students have these questions, that how they have a bit of anxiety how it is going to go when they are at the university. Will they be doing everything on their own, or there will be someone who will be helping them? So this is very thank you so much, all of you, for such a detailed insight about students from second year until the last year, what are going to be the different stages of practicing. So, moving on, I would like to ask questions about admissions and application process. I know we touched a bit of, at the start of the podcast, but if you could again maybe explain in detail what is the admission process for international students, and are there any restriction to any nationality or any students coming from a different nationality, or all the students coming from different part of the world are accepted, different curriculums are accepted?
So I suppose I should start this conversation about admission. So of course, I would like later on maybe my young colleagues will speak. So I'll add some links on the chat. But all our admission procedure is very detailed, step by step is explained on our website. If you go to university's English version of our website, it's explained. So the most important is for an applicant, even we do accept these who are already now in the last year of school. So we are accepting their applications. They are going to our website. There is an active link, apply now, and they're clicking on this and choosing the program they want, and they presenting the application. For application, they need to present the required personal data and to add copies of passport and education documents. If a student now is on the last year of high school, so they should present their predicted grades. So either it's British curriculum or Indian or another, but each school, I know it on my long practice, that schools are presenting their predicted grades, because if applicant presents only the copy of passport, so we don't know anything about the person, and it will take, how to say, our time like admission officers, and as well if it appears the student doesn't know anything about chemistry or biology or maths or physics, so then in any case it will be like stress for them to fail to continue admission. So of course I would recommend to go to our website and to read all these steps, because now it will take time. So the most important is, I'm just as well, I have questions printed that you gave to me, so I'm trying to follow them. So but the most important is to have good knowledge, in chemistry and biology. And already we did spoke about it, that it's not so much important to have it very good grades in your high school, because various, even some diseases could happen or something. So then they may prepare additionally, they may ask some courses or some teachers, private teachers, to help them to prepare to improve their knowledge in chemistry and biology and be successful in our entrance test. Motivational interview as well is a very important part of our admission procedure. And if students are applying to sit entrance test online, so usually our entrance tests are held on Thursday. So now we do have it once per month. When it's going to the late spring, so it will be arranged twice per month. And if an exam is on Thursday, so on the same week, Monday, Tuesday, students are invited for a motivational interview. So it will be like their motivation, their preparedness for studies, and as well some technical part, how to prepare their camera device and their computer for a test. And you did ask me about any restrictions about nationalities, or how we may call. So of course, how to say, I'll use such international word like discrimination. So of course it doesn't exist. There is no discrimination to any people from any country of the world. But applicants should decide by themselves if they physically and even financially are able to come from one or another country and to complete this admission procedure. Because if everything we are doing online, it's okay. And then we are facing the final step to pay. Of course, one thing is, of course, to pay tuition fee for the first semester or first year. It depends on which study program they apply. So it means financial issue. And another thing is, it's 2 years already going, a new requirement for so-called temporary residence permit, because now it doesn't exist any entry visa. Schengen visa as well doesn't work for studies, and students will not be issued this. So it's very important to have to apply to this visa center, so-called VFS Global, as we know. So there are such a centers in Emirates, and they should prepare for this bank statements and so on as well. This procedure as well is very detailed stated on our website. But we have some restrictions, and your question could be how to say to correct. Starting from this year, we somehow temporarily terminated admission from some countries. It's related to some part of Africa and some Asian countries where we do not have any visa center. And from our side, from university side, we may admit the student. It could be the excellent student with very good grades, but then he or she are facing problems, very serious problems, even we may say mission impossible, to apply for temporary residence permit. And as well, it is applying for the first time. It takes about 3 months in average to get an answer. So it's very much complicated. But exactly speaking about Emirates, we know that it's not a very great problem. It takes time and money, but it's not so complicated, so we are able to apply to these visa centers and to get this. And I suppose you, like a company, you may assist them a little bit to show the way how to arrange it. As well, I may mention that on there is this application system, Dream Apply, it's called, it's apply.lsmuni.lt. So the countries that are temporary post, they are listed.
Thank you so much for that detailed answer, ma'am. But I have a couple of follow-up questions to your answer. Firstly, you mentioned that if a student is still studying in their high school, they can present predicted scores. So in that case, if they are able to clear the entrance exam, will the admission be conditional? That they will have to present their final high school grades to get a final offer letter. If so, in case they are not able to perform really well or meet the admission requirements mentioned, will there be any repercussion to that? Will their offer be revoked because they did not do well in their high school?
Okay, so very good questions. Very good questions. So firstly, about these who are on the last year and they showed very good entrance test results and motivational interview results. So we are issuing an offer to such a student, and we are trusting the student, and it's not a conditional offer. It's normal, regular offer, and they are supposed to continue their admission. So we trust them, and as registration fee, they're accepting offer, they're paying registration fee, they're issuing study contract and asking to pay tuition fee, and it means the student could be admitted until the end stop of our admission process. And of course, it will be written in the final note from university. On your arrival, student must present final school graduation certificate. If, for example, student is arriving, getting temporary residence permit and so on, arriving, and there is no document. So then it's a problem for the student, because we're saying, okay, you are not a student, you should go home, and we are crossing out him from our student list. For example, you may say for these who British curriculum, if we're doing now this spring A-level, advanced level examination, so we'll have only statements of results. And final A-level certificates will be issued only in November. I know this for sure. So then again, it's my business. I am waiting for it. I am putting in my so-called blacklist, and what I'm doing, I'm pushing them to present it. And we are waiting I'll state it like a secret. We are waiting until the new year. And it were cases that if student didn't present, we stopped the studies. So in general, to make final step on this, that we may admit with predicted grades, and trusting the students supposed to get final on September 1st to get a final certificate. And I didn't mention, it's important, I didn't mention about entrance test, that we do allow one time to receive the entrance test in some time period. For example, if student doing exam today and failing, so okay, it's time until end of June. So after 1-2 months, we allow to receive the test one more time. So it means entrance test 2 times. I suppose I did answer to your question.
Absolutely, ma'am. And it's good to know that they have 2 attempts in case they are not able to clear the exam in the first attempt. They still have one more chance to clear their exam with the university. That's just wonderful to know. I'm sure students are going to be, I mean, we would recommend them to clear at the first attempt, but in case they don't, then they still have their chance with the university. So yeah, that answers my question. My second question is about the entrance exam, which is if you could elaborate a bit about the pattern of the exam and how the student is evaluated. So is it multiple choice questions, and in the interview, what all are the key things that you are looking into the students? You mentioned that they have to have motivation to study medicine or the course that they have desired, they have chosen. Also, they should know a bit about the country and the university and faculty. But are there any key elements that you look into a student while you shortlist them to be part of your university?
So if to speak about entrance exam by itself, so it's multiple choice tests. So there are 30 questions in chemistry and 30 questions in biology. As well, if students will go to English version of our website, so there is a button to look for it. And when student registers for a test, so usually they are doing it some 1 month or 2-3 weeks before. So as inviting them for our interview before the test, we are already giving them a link to do a demo version. So they may try at home to do demo version and to see how the exams goes on. This is, and about motivation interview, so I think at least we mentioned all items to be questioned or answered during the motivation interview. The most important for students is to somehow to relax during the entrance, during the motivational interview, because they're just nervous and maybe they know more and better, but they are just being nervous and they are not able to answer. So of course I understand that they could be afraid of this, but you may just recommend them just to relax, to speak free. Of course, usual motivation is that when students are applying to medicine or dentistry, they're telling, from my childhood, I wanted to help people. So I know this already by heart, that from my childhood, I like to help people. Okay, I do allow them to tell this, but sometimes we do ask a little bit deeper understanding of treatment of human being, because it's important. And if somebody applies to veterinary medicine, so as well, we should ask if you are not afraid of animals, either it's pets, small or big, horses or pigs or cows. So as well, it's some specifics could be on motivation interview. And for example, if to pharmacy as well, so we should ask a person, because that his work will not be related maybe to people. It will be more in labs or in pharmacies and so on. So but we do, what I want to mention, and students are asking this as well, that during the motivational interview, we do not ask any question related to chemistry or to biology. We could mention some simple, like, what do you know about the human body or something, but not like, please on chemistry tell some formula or something. It is checked by our entrance test. And once more to mention, as well, you should tell this to students now, due to very high technologies around the world. So our future students were trying to cheat. Yeah, and we do notice that it's becoming popular. So as if we are simply, I'll say, if we are catching it, we see that because we may pin the person, we are looking around it to the camera. And if a case, so we are stopping exam and do not allow to continue entrance test. Of course, the application is cancelled too. So students may, as well, they may tell and prove you that if any such a cheating case at university already, so studies are stopped for 1 year for sure. So that's
Really
all.
really appreciate that detailing about the exams. Moving on, if you could also elaborate about the tuition fees, the cost of living, and if there are any other financial requirements that students should or parents should be already prepared to budget themselves. So, if you could elaborate on that, that would be really helpful.
So about tuition fees, so of course I will not list all the tuition fees. It's possible to find on our website. If exactly, for example, to medicine, go to click on medicine program and you'll see tuition fees. Unfortunately, it was a little bit increased from last year, but not very greatly. So now for medicine, yes, I may just tell you for medicine where it is. Yeah, 1 second. I tell you exact number. For medicine, it is. Where is my medicine? Where is medicine? Oh, yeah. So for medicine, tuition fee now is for the first year is first 3 years it is 12,600. So first 3 years, each year they should pay 12,600, and fourth, fifth, and sixth year, each year it will be 13,100 euro. It's for and for dentistry, it's a little bit more expensive. I'm going back to dentistry, not to make a mistake. Yeah, for dentistry, it is now first 3 years, each year is 13,600, and fourth and fifth year is 14,100 euro. So it's for tuition fee. For accommodation. So if to stay in university dormitory, so I'm checking with my colleague Oshra, so average 100 for one person, 100 or from 100 to 200, yeah?
230.
230, yeah? So because we are proposing only shared rooms, 2 students are living in 1 room, so it's from one, it depends on which we have some dormitories, depends on quality of the dormitory, so it could be per month 100, 150, and it includes internet, it includes water, heating, all services. And it's important, my colleague, she's responsible so for accommodation, she's sitting in front of me, so she's adding that university promises dormitory accommodation for the first year students, since we are in lack of accommodation places. So then after second year or after the first year, so we do ask them maybe to look for some private dormitory or private apartment.
Yeah, you can confirm the fact because I used to live in dormitories, and yeah, the first year university students always get promised because the first years are pretty much new. We also get sometimes 18 years or 17 years old, and they can't survive outside, of course, in a new country. So yeah, university promises them for first year 12 months of contract, and of course in any case if you do something wrong, then of course they take actions, but until 12 months university doesn't let you go out and stay outside. After second year, of course, because we also again promise new students to get place, someone has to leave. So in that case, the second year students, they leave and the first years again come in, and this includes everything. As Ruta mentioned, it has laundry services, the electronic, it has Wi-Fi connection, everything. So yeah, it's still cheap and good for a first year student to stay in dormitory.
Yeah, and I think it's also important to mention that you are able to move into the dormitories and stay for maybe 3 months while you're looking for an apartment, or 4 months while you're understanding your environment and then seeing if you want to move somewhere else. I lived in the dorms for a year and a half. And then only I found like, oh, I would like this kind of place, or I want to live in the city center or a little bit outside. So this is, the university allows you to move out with 14 days notice is what I had. So I can't speak on what it is now, but within 14 days, you're allowed to move out. So it's actually a very good option.
And just I should mention that our city, Kaunas city, is a student city, and so we have, of course, maybe it's complicated, could be in autumn. The students should take care about renting of apartment in spring, but there is a lot of apartments of such like so-called flats that is possible to rent. People are doing, how to say, local people are doing business on this, where they having flats and proposing it for a rent. As well as possible, for example, 2 free friends just to rent bigger apartment and to have each bedroom, and when it's, of course, when it's too much cheaper. And I do not remember, what was the second part of your question? It was
Apart from tuition and accommodation, are there any other costs involved that students should be prepared for? Any additional cost of different services or anything?
So there is not, as a library is for free, so public transportation with a student card is for sure cheap. So of course, when students are coming from Emirates, of course, they are supposed everybody to have temporary residence permit. So they should pay for this migration procedures. It's some payment each 2 years as well. They should have health insurance, so as well it costs. If to eat, I don't know, maybe students will tell how much they do spend, because for me, I have family, so it's another issue. But in general, what we are telling, it's about for each month, just to eat, to get some dress or something, it could be some 500-600 euros. Is it true, students?
Yeah, this sounds about right. I live with my sister, so our rent is shared, so it's a little bit easier. But I have a dog, so she costs me a lot. But I end up around 450 for a month, and that's not considering, like Ruta said already, redoing your immigration or paying your insurance or anything like that. It's just baseline 450, and that is when I restrict myself. So I do live very much like maybe only once every 2 weeks eating out. I don't buy many clothes. So at a minimum, you are reaching about 400. You can't do less than that, unfortunately.
And as well, shortly, just mentioning the note, I think students will approve me that I'm telling the truth, that Lithuania is becoming not a cheap country. And it's like middle like Germany, I think. So
in my first year, it was very affordable, especially living in the dorms. Everything was okay. I was living very nicely on 300, but now it's different. It's definitely, the country is growing and developing very much, so it's still beautiful to live and everything is very safe and everything, but it's come with definitely an increase in cost.
Just I should mention it because future students should prepare for it.
Yeah, it's a true fact that when I came in 2021, things have changed a lot. Like, it used to be actually called as cheap, but not anymore. So yeah, of course, with security, with this good standard of living, you need to give something, right? So yeah, things are changing now, but of course not so as expensive as we could compare to Germany or France or Italia. Of course, what Dianka already mentioned, that it's like around 450, 400. It's after your second year. If you are living in the dormitory for the first year, majority of your money goes to the apartments, right? So if you're living in a dormitory, you can still end up at the end of the month around 300 or 350. I'm not promising you. It depends upon how much you eat or how much you are spending on clothes and what's your gym, and if you own a dog or a cat. Of course, but still, if you're living in a dormitory, it's kind of cheap. But again, from second year, you should be prepared for your expenses.
Yeah. Also, when you enter your clinical phase, you need to maybe buy some scrubs, some not equipment in terms of medicine. In terms of dentistry, there are some other expenses that I'm not aware of, but they have to buy some of their toolkits, things like that. But in terms of medicine, you will need maybe 2-3 pairs of scrubs. you can have to buy a stethoscope. So it gets a little bit expensive, but it's not the worst thing in the world. If we were living in the Netherlands, we would not be talking about complaining about the prices we pay now. So it's different.
Yeah, so just to help the students, what we always mention them is always try to contact your mentors, because mentors are assigned when you are in your country itself. So you try to contact your mentors, and of course the mentors are given from your same faculty, so they know what you are supposed to spend in Lithuania. So if you think that buying a stethoscope, buying a scrub or slippers or any kind of gloves and mask is going to be expensive in Lithuania, you better buy it from your country. So we always mention to students, if you think that it's going to be expensive for you in Europe, you buy it from your country and you should come prepared. So yeah, people save a lot on such kind of expenses when they buy in their own countries.
And as well, there is a lot of internet shops. So
All right. So, definitely very helpful insights. I just have one question with this. Does tuition fees and accommodation at the dormitories have installments for students to make the payments?
yes, so for first year students, we do ask to pay to secure their study place. We do ask to pay tuition fee for the first semester, just signing the study contract and paying in advance. After that, students are based on study contract regulations. They are paying each semester, and it's even they're paying not on the beginning. It's even for autumn semester they're paying in October someday, and in March for spring semester. As well, if some students they may have some personal problems, financial problems, they may write application to the name of the rector, and it could be even allowed to pay in smaller portions.
Are
And
there any
yeah,
scholarships available?
yeah, smaller portions, of course, it could be better and easier. And there are some scholarships. They are granted to some very active and good studying students, but of course, it's not covering tuition fee in full.
Yes. So, for example, one of the scholarships that I always apply for in a year, it's you have to do very many student activities because the scholarship is awarded for internationality. So, if you're maybe an ambassador like I am, or you're active in the student association, that's when you are awarded these scholarships, and your grades also have to be above 8, so 80% or an A. Also, now that my sister is here, we are able to apply for a discount when our sibling is in the same university. And that depends on if both of your grades, and it depends on if the university has the funds for that semester or not. And it's semester based. And it can be up to 10% discount on your tuition, but not more than that. So that is something to keep in mind.
These are like some general scholarships which are given by the name of the rector to the students, but we also have faculty-based scholarships. For example, pharmacy has Camelia Vestina scholarship, in which fourth year pharmacy students, for their good standing and good achievements, they have been provided just to pharmacy students. Medicine students, they have some faculty scholarships too. So of course the competition is pretty much high, but the main criteria is you should have 80% or above 8 GPA, and you can apply for it.
Yeah, so for medical students, so Dianka, you may just prove as well that we have some scholarships based on some famous professors, their funds. They're giving, of course, it's a very great competition that it's possible to get, and each year some students, international students, they're getting these scholarships.
Yeah, it's around 8, in between 8 and 10 medical students not medical, in total students that obtain it. So it is very competitive.
All right. Okay. So there are opportunities if at all student is studying very hard, they will be rewarded if they wish to apply for any scholarships. So, like since we are talking about international students, you have briefly touched upon the visa process. If you could also elaborate a bit on what are the common challenges or mistakes students do while they're applying for visas, and how well they should be prepared for how they can avoid making those mistakes while they're applying for Lithuanian visas.
Just I do wonder what to tell, what mistakes. When applying from the beginning for the first year, so it's the most important to know that they should present, as applying, should present their bank statement, and to show a not very small sum of money is, if not to make a mistake, in any case, it's changing each year because it depends on the minimum salary in Lithuania. But at the moment, I think they should show on their name 5,600 euro. And if it is not on student's name and it is, for example, on parent's name, so then students should prepare so-called affidavit that, okay, this person is saying, okay, I'll cover all the expenses of my son or of my daughter. As well, it's important to have this police document and what mistakes you said they may doing, not to ask to be issued this police clearance very early, because it's valid 6 months. So it's very important to ask it, to get just signing study contract, already packing your luggage, then ask for this police clearance. And as well as I already mentioned before, as from the day of application, then this visa center is accepting your documents. As well, they are inviting for interviews. So it could take about 3-4 months. So as well, students should calculate their time being, and university during the September, we are just waiting for new students to arrive. But please understand that it's complicated for them. They're missing first classes. Classes are starting from 1st of September. So it's too much required and too much preferable to come until 1st of September. So we are not closing our application system until 5th of July, but students coming from who needs temporary residence permit, so we highly recommend it to complete the admission procedure, not just end of May, and then to start application for temporary residence permit.
Especially problems that I've heard of as a mentor and as just speaking to first year students now, is that they often forget steps, which is very strange. So it's very important to follow every single step. Like, you have to submit all of the documents, because the delay of having to redo that application, and the redo of the application is only allowed once. So you cannot keep applying and applying and applying in the same year. It's very important that you submit right from the get-go everything, and make sure you have the right, how to explain. So for the police clearance, in my time, I'm not sure if it's the same right now, I not only needed the police clearance certified, but I needed it apostillized. And I didn't look at that, and I didn't do it properly. So my parents had to DHL me documents, so that they were not happy, and it was very expensive. So it's very important to check out every single step and ask for clarification if you need it.
Yeah, I didn't mention this. I know it's very good, but I didn't mention that for sure. Police clearances, all police clearances should be legalized. So in one country it's apostille, in another country it could be this Ministry of Foreign Affairs. So for Emirates, it's, I think now you are having Ministry of Foreign Affairs. This is, yeah, and as well for students, when already in future, just do not forget that your TRP, we are calling it abbreviation TRP, is going to the end. That deadline is approaching, because it's again a time to renew it. If you are next day, it's already expired, so you can't apply one day before. It's again at least 1 month should be. So it's one of obligations of the students. One line is to study very good, to attend classes and lectures, but another thing is to take care about temporary residence permit. It's important.
Yeah, students make this huge mistake after they've arrived here. For example, if they got their TRP for 2 years, which I also got the same because I'm a third world country person. So students tend to forget the dates when their card is expiring. And it's not just one day before you realize that, oh my God, my card is expiring. It's either 3 months if you're planning to apply for general procedure, or even if you forget, like for 3 months, at least 1 month before, so you can at least apply for urgent procedure. Of course, it's going to be expensive, but still you are saved. If you are realizing it like 15 or 20 days before your card is expiring, unfortunately, university can't help you, neither the government. You have to pack your bags and leave, because basically you are illegally living in that country. So to avoid this, university can't help you because this is your problem, like your mistake. University also has a program which reminds you that please keep in mind that your card is going to expire, and if you ignore those mails, it's your problem. So please do not make such kind of mistakes. Keep reminders, anything, any kind of pinpoints and cheats in on your laptop that my card is expiring, because as Ruta mentioned, this is your second obligation after your studies, that you should be legally staying here, not forgetting your dates.
And as well, I want to mention that we do have a very nice officer in our international office. She's now new because we have another one now. Her name is Oshra, and all students and new and already actual students are welcome to consult and to ask any, even as I'm telling, crazy question, but to ask, to be clear what we should do and what is the time periods to complete the procedure. So our office is always welcome and open for them.
Right. So please, students, do not make these mistakes and be on top of every checklist that is provided for visas. Prepare your documents well in advance, and ensure you double check, triple check to not miss out on any small information, because that can lead to termination of your visas, or missing up of appointment, and then maybe getting another appointment is another delay that can add to your studies. So Ms. Ruta, in case the student has applied for visa, however, they haven't heard back from the embassy, and the time is flying. So are there any temporary online classes for students to start their studies if they are at all not able to join university on 1st of September?
Yes, so at university there is arranged such a procedure that lectures, mostly all lectures, especially at the beginning of new year, they are available online. So either it is recorded lecture or there is based on a schedule. It is possible to join the lecture and teacher is speaking to the auditorium, or either it's speaking exactly to the students who are online. So even not even lectures, but then some works could be done. But of course, as it is some labs or some practices, of course, it could be done only at university. And I should mention that during the COVID, lectures were going online, and all the practice works were moved to the end of COVID disease of this, and when students came and completed it.
So sorry, yeah.
It's okay. No, ask me. Yeah, ask your question.
No, so I just wanted to make sure that students understand this, that in certain edge cases, you will have access to online material to study lectures, but it is very essential to do your course in person at the university rather than just being a little laid back and attending it online, right?
I want as well to mention that students who are, it seems that they are late already for studies, they are not coming on 1st of September. So they obligatory should check for the links, for everything, or what they need to join these online lectures. Because somebody were not doing so, they're coming in October saying, I do not have anything, I don't know, and so on and so on. And this problem is not only for the student, but it's problem for the teachers, because they should work additionally, and so on and so on.
Yeah, and it's important to mention that very many of the socialization activities happen in that first 2 weeks. So you're making all of your friends, and as a student association leader, we arrange those events so that there are many events that students can attend every day, make as many friends as possible, and socialize as well as possible. So when those students come late, they miss out, and it's difficult for them sometimes to slide into this when people already know each other, have made friends. It's not impossible, so I'm not trying to scare you, but it's something that it's very much fun, and it's not so nice to miss out on. So take note of that.
Just about the lectures, and for example, the students, if they're missing any kind of lectures, of course, it's your obligation to stay updated about the mails. And so basically, university has 3 or 4 platforms: Teams, LSMUSes, Outlook, and other places where professors can upload different things. So it's your obligation to, it's your responsibility to check every platform every morning when you're supposed to have a class. And then at the end of the day, you should have a checklist wherein you attended every lecture. If you are not in Lithuania, of course. If you are in Lithuania, of course, you're supposed to go to the lecture and meet the professor face to face. So, of course, communication is key. We always mention our juniors or the new year students or first years, check your mails, and, because the main primary contact from your professor and you is the mail. So just check your mail IDs and check what mails did you receive last night or yesterday.
Thank you so much for that. As we are coming to the end of this podcast, I just have a last couple of questions. After the student is graduating, what are the next steps? So, how does university prepare students for licensure exams in Lithuania or in other countries, such as if the student wants to go USA, there's USMLE. If they want to go UK, there is PLAB. So, how does university ensures that the student is in aligned, meant to their goals of where they want to, settle finally after their studies?
So even I don't know, I should mention it, or students, do you have some comments on this? Oh. Okay, so
I do regarding, for example, my plan is to stay in Lithuania after I graduated. So I'm studying pharmacy. So any healthcare professional, if he or she wants to work in Lithuania and get a license according to your degree, if it's a doctor or pharmacist or oncologist or odontologist, you are supposed to give B1 Lithuanian language exam, which is national language. I'm prepared for it and I already passed my language exams for Lithuania, and all I'm waiting for is for my diploma, and I start work as a pharmacist. So if it's in European countries, it's just language exam because Lithuanian degree is valid all over European states. If you are going outside Europe, then of course you are supposed to give some kind of language, not just language, but also some entrance tests, which I'm not planning to. So I'm sorry, but I have no information about it.
I have a bit of info, but it's not because I'm doing it, but rather many of the students that want to return back to the US or USMLEs, things like that, they prepare independently because we don't have time in our very busy curriculum to also prepare for other kinds of entrance exams. So they know where they want to go afterwards. They know either they want to return home, they want to return to a new country. So this is very much independent, and it's up to you, which is, it's normal.
As Bianca mentioned, yes, students are preparing, for example, for this American United States exam assembly. They're preparing independently. Of course, there are books available in libraries and so on. As I know on my practice from our graduates, that they are successful to do first and second step of the assembly. That is theoretical one. And if to go exactly to practice to be a practitioner to be a GP in the United States, so our medical program, our medicine course, is completely recognized now in United States. It was called United States. They did ask to renew recognition, and it was completed last year, so it's completely recognized. And third step, of course, assembly is done in each state by itself. Of course, it's not easy, but those who do want, they're doing. And we have, I can't say that a lot, but we have applicants, mostly maybe they're this Israeli, Lebanese people, they like to go to the United States and to practice when they're successful here. And as Faisal mentioned, of course, for each country, either it's Germany or France or Italy, of course, you should sit for local language test because you communicate with sick people, with patients, and each country may, if you want to get a license as a GP, so they may ask you to sit chance test to check your knowledge, because the country's government is responsible for human being treatment and they want to check. But usually they are successful. For example, we have a lot of students from Israel, so we know that they are very much successful during the license test in Israel, and they're passing for the first time.
If you're planning to, or if you have a concrete plan that after your graduation, either you are supposed to stay in Lithuania or you're supposed to go to Germany or France or any other country, we always prepare students to have a plan, and if you have a plan, then start preparing for that language. So I have many friends who are studying medicine in their 4th year, and they started studying German language in their 4th year itself. So now they have 3 years to study German, plus they get the diploma and directly go to Germany and start working. So basically, once they get graduated, they are not wasting 1 year to study German language. So basically, they have a plan.
Yes, and as I know, so we have very successful graduates who are already practicing as a doctors in Germany. And if to mention, it's important, of course, local language examination for license, but it is very important to mention that as graduating, you are getting master degree in health sciences and your qualification is medical doctor. But in any case, you should do this residency just to become either family doctor, either cardiologist, and so on. So each country has a little bit different requirements. So, for example, as we have as well a lot of students from Sweden, so as they know, they're successfully doing this residencies in their hospitals and becoming then famous doctors.
Right. So, if at all the student decides to stay back in Lithuania, then what are the steps that they have to follow? Or if you could, just briefly explain us that step one, you have to fill in this application and then do this and do that, like that.
So you mean asking after graduation if student decides to stay and to practice in Lithuania, yeah?
Practice. Yeah.
So of course, then it could be easier maybe if to do it in another country outside Lithuania, because diploma is then you should not prove that it's a good diploma because it's completely not just recognized. So we have a special state organization which issues licenses. So as applying, presenting graduation diploma supplement, and of course, as Faisal mentioned, it should be exam results at level B1 in Lithuanian language. So this one. And as I already as well mentioned about this, that on graduation, you are medical doctor, but you should do then in Lithuania, people as well should search, our graduates should search for some residency. If, for example, our Kauno Klinikos, our university hospital, so it's very popular, maybe it will be very competitive to get a residency in our Kauno Klinikos, but it's as well as possible. And I think it's the same like around the world, that if you go to regional cities, to smaller cities, so as well as possible to do residency, and it's more easier to work and to get this place. And as I know, we have our doctors who are working outside our city in the smaller regional cities, and they are doing their residency.
So again, really appreciate that insight. My last question. So, what advice or what suggestions, recommendations would you give to a student who is now preparing for LUHS entrance exams and who is ready to become a doctor, who is aspiring to become a doctor? So, what advice would you give to our new students?
So my advice would be just now, if you guys missed to study chemistry and biology during your previous years, so do your best. We have beginning of March. It's possible either to ask your teachers to help you, either to check the high school curricula you are having now and to study it very good. It's even possible to sit entrance test even as from Emirates to sit it in end of May. So the most important is now to prepare for entrance test, and it's an academic issue. Another thing is just the family should think about that young person will leave home. He or she will need finances. And if a person being 18 or even 17, but of course preferable 18 and up, will be able to stay abroad. As our students mentioned, we are giving a lot of support, including psychological support for free and consultations for psychological, but family should think about, we should consider if a person is ready to go abroad and to study. One thing to pass entrance test, but another thing is to meet and to face, I would say, very difficult studies. Either it is medicine, it's dentistry, or pharmacy, or other. Because first years are the most stressful. Maybe for medicine and for dentistry, maybe it's not so interesting, and for pharmacy could be so, because it's theory. You should study anatomy, you should study physiology, histology, and so on, these theoretical issues. Later on, it's becoming more interesting, and may already go to the hospital. So I will say that it's academical preparedness and psychological preparedness for going abroad and stay alone with your two parents. There will be no mom, no papa, but good friends.
I agree with that. Good friend. I think my advice would only be that if you have the dream in your heart to be the doctor, to be the dentist, even if you feel like you're not good enough, there is a way. If you're working hard enough, you will be okay. If you have the dream, there's a reason you want to be here. There is a reason you have the passion. There's a reason that you want this and that you want to spend your life helping people. You'll make it happen. So don't be so stressed. I think that's my biggest piece of advice. Don't be so stressed. And Lithuanian University of Health Science is a very, very good choice. It's a good choice.
Yeah, I just have like two messages, one for the parents and one for the children or the students. That for parents is just that once you leave your students or your children like back in Europe or other European countries or abroad, just, I'm talking about their personal experience. Just keep in contact with them, just know about their everyday chores. What are they doing? How's everything going? How are their studies going? Because of course, he or she is just a child, like still 18, 19 or 20, or I don't know if 40, but I'm still a child to my parents, right? So yeah, just keep an eye on them, ask them how everything's going, just not to make them feel homesick, like, because, if you call all of a sudden after 1 week, he or she has to speak a lot. So just call every day, talk with them, everything. For students, of course, to gain something, you have to lose something. So to lose, in the sense, I would say you would be losing your breakfasts, you would be losing your dinners. At some point, you will be losing your friends because you have to act selfish in education. This is my personal experience again. But of course, as Dianka mentioned, nothing goes in vain. Your efforts won't go in vain. Until second year, third year, you will start to realize that this was the best choice of your life. And the moment you will get that degree in your hand and you'll get the graduation cap in your hands, you will feel that it was the best decision of your life.
Wonderful, wonderful. That was very important for students to know. And so to conclude the session, thank you so much for joining, sharing your personal experience, insights, and all the advices that students should follow and should look into. It's really appreciated. I'm sure after this podcast, they already know a lot about the university, and that will make them not just excited, but well prepared when they come to university. So once again, thank you so much for joining, and it was lovely meeting you all for this podcast. Thank you so much.